The nurse-led assessment protocols for nutritional evaluation involve several key steps. Growth monitoring and anthropometric assessment include measuring weight, height, length, and mid-upper arm circumference. MUOC for children under 5, as well as assessing BMI and MUOC for pregnant or lactating women. These measurements are interpreted using WHO UNICEF growth charts and protocols to identify malnutrition or growth abnormalities. Screening for acute malnutrition involves using MUOC tapes and checking for bilateral pitting edema in children, with urgent care referrals for those with MUOC FUVI ELT 115 mm or edema. Micronutrient deficiency screening focuses on observing clinical signs such as pallor for anemia, goiter for iodine deficiency, and night blindness for vitamin A deficiency, with point-of-care hemoglobin meters used when available. Household food security assessment is conducted using tools like the Household Food Insecurity Access Scale, HVAS, or Food Insecurity Experience. Scale FIs calculating the Household Dietary Diversity Score, HDDs, and evaluating coping strategies such as meal skipping or food borrowing. These protocols ensure a comprehensive approach to identifying and addressing nutritional challenges in vulnerable populations. Risk factors identified by nurses for various nutrition problems highlight critical areas of concern. Undernutrition is primarily associated with food insecurity, low dietary diversity, frequent infections, and poor infant feeding practices. Stunting, often a result of chronic food insecurity, is exacerbated by repeated infections, poor maternal nutrition, and inadequate sanitation. Wasting is linked to acute food shortages, disease outbreaks, displacement, and lack of access to healthcare, while obesity has been attributed to increased access to processed foods, reduced physical activity, and urbanization. Lastly, micronutrient deficiencies commonly stem from monotonous diets, lack of fortified foods, poor maternal nutrition, and limited access to supplements. Addressing these risk factors is essential for improving nutritional outcomes and overall health. Community health needs prioritization involves several structured techniques to identify and address the most pressing health issues effectively. The Hanlon method is a widely used approach that begins by listing health or nutrition problems, scoring them based on size, seriousness, and the effectiveness of interventions, and then applying the Pearl test: pertinence, economic feasibility, acceptability, resources, and legality to calculate and rank priority scores. Another method, the prioritization matrix, involves listing needs alongside criteria such as prevalence, severity, and feasibility, assigning scores to each, and summing them to rank priorities. The nominal group technique, NGT, and multivoting emphasize community engagement by facilitating group discussions and voting among community members and health workers to determine priorities. Lastly, the PATCH framework planned approach to community health focuses on collecting and analyzing community data involving stakeholders in identifying and prioritizing needs and developing action plans based on these priorities. These techniques ensure a systematic and inclusive approach to addressing community health challenges. In low-resource environments, effective data collection methods are essential for assessing community health and nutrition needs. Rapid nutrition surveys are short, focused surveys that often include anthropometric measurements to quickly assess the nutritional status of individuals or populations. The SMART methodology, standardized monitoring and assessment of relief and transitions, combines anthropometry, mortality, and food security indicators to provide a comprehensive understanding of health and nutrition conditions, particularly in emergency or resource-limited settings. Key informant interviews gather qualitative data by engaging community leaders and affected families, offering insights into local challenges and needs. Additionally, community mapping involves participatory techniques to map critical resources such as food sources, health facilities, and vulnerable households, enabling communities to visualize and address gaps in services. These methods are tailored to maximize efficiency and accuracy while addressing the constraints of low-resource settings. Integrating findings into care planning involves addressing needs at multiple levels. At the individual level, malnourished children and mothers should be referred to treatment programs like therapeutic feeding or supplementation. At the community level, data can guide education, targeted food distribution, and advocacy efforts. Clear referral pathways should also be established, ensuring protocols are in place for escalation to higher-level care or specialized services. Barriers to effective health interventions include limited diagnostic tools, cultural and language barriers, infrastructure challenges, and data gaps. Evidence-based solutions include using simple anthropometric tools, MELF, and telemedicine, engaging community health workers for education, adopting decentralized models and mobile clinics, improving data recording with digital tools, enhancing awareness through capacity building and mentorship, and addressing data gaps with participatory vulnerability analysis and mixed methods.